I'm Tanner Aliff. I'm the policy director for the Center on Health and Families at the Texas Public Policy Foundation. So thank you, Chair Colcourse, Vice Chair Perry, and the rest of the members of the committee for taking the time to hear my public testimony. Due to a host of some really short-sighted federal regulations, I'd say Texans are struggling under the weight of astronomical medical bills and ever-increasing premiums and deductibles. Since the passage of the Affordable Care Act, the average Texas family has seen their premiums increase by over 55%. Today, Texas families and their employers are paying on average about $22,334 per year in premiums. To make things worse, researchers at Johns Hopkins are finding that nearly 60% of Americans with medical debt and had health insurance, which is kind of contradictory in its purpose. The good news, though, is that Texas doesn't need to rely on traditional health insurance to afford care. There's a growing body of alternative coverage arrangements and cash-based health providers that are helping Texans save 300 to 1,000% on out-of-pocket healthcare costs. And earlier this year, I had the privilege of convening over 30 CEOs and founders of innovative Texas companies who are excited to hear about the opportunities presented by HB 2002, a bill which you passed during the 87th legislature. The leaders of these innovative companies are doing amazing things like turning risk pools into medical bill sharing communities with crowdsourcing. They're taking cash-based urgent cares and partnering with cash-based independent imaging centers to create an affordable continuum of care without needing health insurance. Price transparency companies are creating tools that show Texans where's the best place to get a 5-star MRI that's only $297 instead of going across the street to a hospital for $3,000. And I just want to say, because of your work on HB 2002, it's provided patients with a new incentive to shop for affordable health care, and there are groups responding to that. And I just want to close out as we do not have a shortage of coverage. We do have a shortage of providers, but the thing that's really, truly hurting Texas is that we have a lack of competition. And more importantly, we have a lack of competition against competing, differing models in the payment for our healthcare as well as the provision of our healthcare.